Hi, I'm Dr.Singh-Bryan with Core, and today we're going to talk about how to fill your pillbox. Firstly, choose a pillbox that is right for you. Sometimes it's just twice a day, sometimes we have multiple times a day. So some people have 2 pillboxes because they have to keep them in 2 separate sides of the house. So it's very important to choose the one that is right for you. Now, let's just touch on a few things. Don't forget that pillboxes are not childproof. So it's very important when you use a pillbox to put it somewhere safe and secure so that children will not interfere. Now, there are some pillboxes like this one that has a case that you can find, which may provide some extra security for if you have small children in the house. Always have an updated medication list. Now, this is included in the presentation, so you will see. But as we go to different doctors, many times doses change. However, we have the previous prescription at home, so having an updated medication list will help you to stay on top of your medicines. Another point to remember is to only put your scheduled medication in your pillbox. As needed medications, for example, your pain meds, those are better left in the pill bottles because adding them to your pill box may cause some confusion. Lastly, all of us struggle with memory. I'll confess, my Google Calendar is my life. So if you find that memory is an issue for you, don't feel fearful to ask somebody to help you. Go ahead, a child, your parent, somebody to help you to load your pillbox. Okay, so let's get ready. First things first, find a surface large, clear it off, get all your pill bottles lined up, get your medication list ready, get your medicines, anything that you need. You may need a list to record what needs a refill, so prepare yourself to fill your pillbox, okay? If you have multiple medications for certain conditions, for example, if you're taking 3 medications for high blood pressure, put your high blood pressure medications together, put your diabetes medications together so that we can start the process and be complete. So let's go ahead and fill our pillbox. Points to remember: fill the pillbox on the same day every week. So if you're going to fill it on Sundays, fill it on Sundays. Why do we do that? If the day that you fill your pillbox changes, it will be hard for you to keep up with if you are taking your medicines consistently. For example, today is Saturday. I'm going to start filling my pillboxes on Saturday. But suppose I get to Thursday and I say, oh, I'm just going to go ahead and put Monday, Tuesday, Wednesday back in the pillbox. When we look back, we won't be able to keep track if we were consistently taking our meds. One of the #1 reasons why we encourage pillboxes is because it serves as a reminder. I look at this pill bottle. Did I take my furosemide? I'm not sure. Many of us were not going to count the pills. However, if you have your pillbox, you look down. Man, I forgot to take it this morning. So it serves as a great reminder to take your medications daily, and it also helps you to know if you took your medication this morning, last night, so on and so forth. Okay? When it comes to refills, we encourage patients to call in their refills a few days ahead of time. Sometimes the medications have to be ordered. Sometimes we have to get authorization from the doctor's offices. So calling in your meds early helps for you to get them on time. So this is an example of my medication list that we're going to use to fill the pillbox. Okay? So I have 5 medications. We have gabapentin, 1 capsule at bedtime. We have metformin, 1 tablet twice a day. We have levothyroxine, take 1 tablet 1 hour first thing in the morning before meds and food. We have lisinopril, take 1 tablet once daily. And we have furosemide, take 1 tablet once daily. That's the directions on our bottle. Looking at our med list, we're going to start. Now, you notice on our med list that the directions for the furosemide says 40 milligrams, take 1 tablet once daily. What does that mean? We went to the doctor and the doctor said, okay, I need to increase your Lasix, but I know you just picked up a refill, so instead of taking 1 pill, I want you to take 2. So I came home, I put a mark on my bottle to say take 2 tablets instead of 1. So that's an example of the importance of the medication list and keeping it updated. So now I'm going to load my pill box. First thing I'm going to put in is my Lasix. So I open straight across. It's very important to load 1 medication at a time. So we're going to load the whole week. Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday. So that's our Lasix. And looking at my pill box, I forgot to put 2. So that is why we go ahead and keep our medication list there, because the doctor increased it to 2 pills. So I'll go ahead and put 2. Okay, now we close our pill box. We go ahead and look. Okay, I'm going to run out, but the doctor gave me a new prescription that says 40 milligrams. So I make a note. I'm going to have to take that prescription in. Next medication we're going to fill is our levothyroxine. So levothyroxine is one of those very common medications that have to be separated from food, and it has to be separated from other medications by an hour. So although it's a morning medication, for somebody who is taking levothyroxine, this may be a medicine that you would consider to put in its own spot. So you wouldn't have to pull it out of the other medications in the morning time when you need to take it. So checking the medication against my med list, it is correct. There has been no changes. So I'm going to go ahead and load my levothyroxine. 1 every day as directed. Looking on it, will be good. We don't need any refills, so we'll put that aside. The lisinopril, 1 tablet once a day. No special directions with lisinopril, does not have to be separated, so we can go ahead and load it in with our Lasix. Remember, load 1 medication at a time. So another thing I'd like to point out it's very important to try and stay focused when you fill your pill box. If you know, for example, in my house, we love to watch Family Feud. I'm always watching Family Feud. It may not be a good idea to load my pill box because I'll be distracted and I'll forget where I'm at and I'll be like, oh, what was I doing? So try to pick a time when it's not distracting where you can focus on your pill box. Now, I'm going to do my metformin. My metformin is twice daily. So I'm going to put it 1 in the morning and 1 in the evening time. So I'm going to open up my other section and load the metformin. Morning, evening, morning, evening, morning, evening, morning, evening, morning, evening, morning, evening, morning, evening. All right, look on my metformin. You know I only have a couple of those. I take that twice a day, so I need to put that over on the refill side. Lastly, gabapentin is a medication that many people take, and because it causes drowsiness, it tends to be given at bedtime. So look, this pill box that I have actually has a bedtime section separate from an evening section, because, for example, metformin, most people take that with meals. Gabapentin you will take right before bedtime because it makes you sleepy, so we can't put that one in the bedtime section. That way we won't have to pull it out of the evening section. So I'm loading my gabapentin. So I'd like to point out at this time, that it's very important that you know your medicines. For demonstration purposes, I'm using Skittles, nicely colored, look very different from each other, but in reality, that's not what happens with medications. In reality, most medications look the same, the colors are similar, the shape is similar, so it is very important that you know your medicines. Be confident if the medication looks different. If the pharmacy did not point it out to you, go ahead, call the pharmacy, ask the pharmacist, this does not look like my Lasix last month. I just want to double check. There's nothing wrong with that. Okay, so I encourage patients to do that. The next slide is a pharmacy label, standard pharmacy label, just to show you, remind you what it looks like, certain things on the label you want to keep track of, when the medication was filled, when the medication expires, how many refills you have, plus, you know, the other parts of the label. Thank you for viewing this video. Please feel free to view other videos on our Quad E page and subscribe. Thank you.